I'm happy she's speaking to our community, especially in Africa. You know, we have very superstitious beliefs about cancer. It's not a death sentence. Education has advanced to the point where people are surviving cancer. So I'm so happy, and thanks to Gift to also share their story. Dr. Samuel Otene. I hope Dr. Otene is ready for me. I'm just going to read his biography while I invite him to speak. Dr. Otene is the chairman of the Nigerian Medical Association National Committee on Cancer Awareness, Prevention and Treatment Guidelines. He's a radiation and clinical oncologist and is an active member of Nigeria's Technical Working Committee on Cancer Control. He was national president of the Hospice and Palliative Care Association of Nigeria from 2015 to 2019, state chairman of NME Benue State from 2020 to 2022, chief resident, Department of Oncology, Ahmadu Bello University Teaching Hospital, Zaria from 2007 to 2012. Dr. Otene is an oncologist at the Ukpo Comprehensive Cancer Center, Calabar, Nigeria. He has been a member of several national ministerial committees on cancer and palliative care, working to curb the menace of cancer in Nigeria. This is a wonderful person we have. She's going to be speaking with us right now. Dr. Otene, are you there? So he's going to be talking on how to create conversations, empowering dialogue. So very short. I'm going to read time.
Good afternoon. So, well, thank you very much. I just want to take this opportunity to thank Pink Africa Foundation and our Pink Lady, Dr. Annie. You have been wonderful. You've been doing great. This is another great opportunity. I listened to the NCS president speak about the consortium, the Breaking Bad News Consortium. Max, I think I should just delve into the meat of the matter because I just have another 15 to 20 minutes and I should be done with this discussion. Yes, we're talking about navigating conversations, empowering dialogues on cancer, and this is my outline. Yes, you have already run down into the introduction, so I think I might as well run along to catch up with you. Yeah, you can go on with that next slide. Don't be worried about the long list in that long list. I will get through it very quickly. I just wanted to mention that communication is a critical aspect of cancer care. It's very, very important. Effective dialogue is not just a skill, it's a powerful tool that helps us to foster hope, understanding, and support for those, our patients and their relatives that are facing cancer. And in truth, it is one of those areas where we have to combine both the science that we learned in medical school, in nursing school, in all our various schools as healthcare providers in the science, in the cancer sector, along with the art itself. You know, it's a very, very delicate combination of art and science. Otherwise, we are likely to end up throwing a lot of facts, throwing a lot of data and statistics at the patient and still not getting through to the patient we are discussing. I think we can go to the next slide. Now, I also want us to understand, I think I am going on to the next slide, just to say that cancer itself is not just a medical condition. It is actually an emotional journey. From the moment the diagnosis of cancer is made, everything about the patient's life and even that of their close relative changes completely. So effective communication is the foundation of providing holistic care. We need to see the patient not just as somebody that is the physical being sitting in front of us, but somebody who has a spiritual component, who has psychosocial component, who has various other components that make that person a whole human being. And the way we communicate with the patient has to address these various aspects of that patient's life. A patient could be sitting in front of us and we are so worried about the physical pain the patient is having, while the major problem that patient has right now at that very point in time is their concern on whether heaven or hell exists and how well they are prepared for the afterlife. It could just be concern about how their relatives are going to treat their spouse after they die, because they have accepted the fact that they might die from this disease, but they are afraid of what could happen. So there are lots of physical, psychosocial, spiritual components to a patient's disease, and our communication, effective communication with these patients, is what serves as a foundation for us understanding all of this, because it influences very key areas of the patient's management, the patient's experience, their treatment adherence, and their overall well-being. All of these are tied to how well we communicate with them. So, thank you. You're on this slide. We're talking about building trust and connection. Now, trust is the core of any meaningful conversation. Really, you cannot have conversation that sinks down where it should if there is no trust between you and the patient or the patient's relative. So it's very important that we establish a connection with our patients and their families so that we can create this supportive atmosphere. We must try to build trust, and many things can contribute to building trust. Even the simple gestures we make towards the patient, how we sit, how we look at them, how empathic we are. There's a difference between empathy and sympathy. How empathic we are with the patient in the course of our communication. How actively they perceive that we are listening to them. Are we fiddling with our phone? I think we can go to the next slide. Are we fiddling with our phone while they are talking with us? Or are we probably telling them to pause while we take a call? Or are we looking somewhere else? How even we sit when we discuss with the patient, all of these are very, very important. Active listening. And it's very important from this slide, like I said, for us to also establish the fact that honesty is crucial. Our communication with the patient has to be as honest as possible. It must be delivered with compassion, and patients must, patients actually have a way of appreciating transparency, even when they are facing very difficult situations, even when the conversation is a difficult one, that the doctor, that the caregiver is transparent, open with them and honest with them is something all patients tend to appreciate. We must try to maintain a good balance between clarity and empathy. We want to tell them everything as clearly as they should know it, but we should also have a way of delivering whatsoever we are delivering, not just throwing facts at them, not just throwing data at them, but showing empathy even in the course of whatsoever we want to deliver with the patients. And especially when we are discussing things like the diagnosis, when we are discussing things like the treatment options. I think we can go to the next slide. When we are discussing things like the prognosis of the disease, all of these are very, very important. I think we can go to the next slide. Thank you. So we must very importantly tailor the communication we are having with the patients to meet with the individuality of the patient. All patients are different. I think my slides are stuck. Good, we are there. Now, each patient is unique, and so we must find a way of tailoring our conversation. What works for one person might not necessarily work for the other one. There are individual differences. There are socio-cultural differences in our patients. There are patients that would prefer you are talking with them and holding their hands. There are patients that will feel insulted if you do talk to them and hold their hands. There are differences in our culture. I know of my nurse, one of my palliative care nurses in Zaria, that's in Kaduna State then, that said she saw a patient, a palliative care patient on their deathbed. And she shocked everybody by just saying, "Can I rub your feet?" It was an unusual situation because she's a lady, this is a man sick on the bed, and she's requesting to rub his feet. But it went a long way, and everybody was shocked. So the point I'm trying to make is that there are certain differences in culture, and all of these should affect our communication, our interaction with our patients. Even their educational background, what the professor in the university will understand will be significantly different from what the farmer who never went to any serious school would understand. Even religious backgrounds. It's one thing to say, to be telling a Christian how in Jesus' name he should expect healing. But if that person sitting in front of you happens to not be a Christian and you are talking in Jesus' name, it twists everything all together. So the point I'm trying to make is that we must try to understand the individuality of our patient, because this enhances understanding. Recognizing and respecting diverse communication styles contributes to a more inclusive healthcare environment. I think we can go to the next slide. Now, when we come to treatment discussions, it's one of those very important areas, again, where we really, really have lots of issues with communication, because there, treatment, discussion has to be very effective because the patient has to get a very clear understanding about the treatment. It's not, we're not just throwing treatments at the patient. Oh, the patient is sitting down. Oh, you have breast cancer. So because you have breast cancer, you're going to have chemotherapy. It will be followed by radiotherapy. Oh, you even had surgery earlier. Then we will do hormonal therapy. And the patient is just locked in the middle of all of these communications, you know. For each of these treatments, the patient has to understand the exact benefits. The patient has to understand the risks. The patient has to understand the potential side effects, because our actual aim is to empower these patients to take an informed decision about their treatment. And the more the patient understands what is going on, the more the patient absorbs what is going on, the much better situation they are placed in order, you know, to be able to join us in taking the treatment decision. Let's go to the next slide, because it is when they are part of the treatment making decision that they tend to better adhere to whatsoever treatments we are giving them. I know so many talks have gone on and much more will go on. Mine is just a fast 15-20 minutes talk, but we cannot overemphasize the place of emotional support and compassion, because it goes well beyond just throwing medical information at the patient. These patients need a lot of emotional support, and we have to acknowledge and address the emotional impact that the cancer is having on these patients and provide reassurance and show empathy. Now, reassurance also is something we have to be very careful about, because we have to be very careful not to give the patient false hope. It's one thing to reassure a patient scientifically, empathically. It's another thing to look at a stage 4 disease patient with metastasis to the lungs and liver and reassure the patient that, no, don't worry, you are in the right place, you are going to get well. Totally two different things. So in as much as we as we are focused on the art itself, we should not divorce the art from the science itself. If we should still know what the prognosis is, and we should not lie to the patients. We should not give false hope. Generally, emotional support and compassionate communication contribute to a more supportive patient experience. I think I have just 2-3 more slides. We can go on. Don't worry, I am also in a hurry to catch up with something else again, somewhere else that I should be. So that seems to also be part of why I'm in a hurry. So sometimes we come up with this question, should we involve the family? The truth about it is that if we can involve the family, if they are willing to be part of the whole care system, it's very well encouraged, because they form a support network for the patient, and encouraging open dialogue within the family creates a more united front. So where we can, where the situation is favorable, I think family discussions should be encouraged, because they help address some pertinent concerns, they help with information sharing, and it just helps to strengthen the overall support system for the patient. Next slide, please. I think the next slide is talking about addressing difficult questions, and let's just be frank about it. Lots of the times we get confronted with very difficult questions from the patients, from their relatives. Let's just know that even the patients know that as healthcare givers we are human. They know that our knowledge is limited. I think most of the time, even when they ask some of these difficult questions, what they expect from us is for us to answer as honestly and as empathically as possible. There is nothing wrong in telling a patient that right now I still need to learn a little bit more about what you're just asking me. There's nothing wrong with making a patient know that you need to make a little extra research to be in a better position to answer their question very appropriately. But the point is that they need to see us being honest with them. They need to see us being empathic. And navigating difficult conversations helps to build resilience and foster trust in the patient-provider relationship. I think we can go to the next slide, and we are almost done. I know we will have a lot of practical communication strategies in the course of this discussion, you know, but I just gave these 2-3 points where I know they will be hammered over and over again, maybe with even some practical demonstrations. 20 minutes is just not enough time, but let's just know that it's important we keep every conversation with our patients as clear and simple in language as possible. We should encourage our patients to ask questions. We should have regular check-ins. Do you understand what I'm saying? Okay, what do you think? Let it be a conversation between us and the patient or the patient's relative. Let it not just be a lecture where we are sitting and throwing things at them, and we don't even have any way of knowing how much of whatsoever we are throwing at them is actually sinking in. Communication, let us also remember, is an ongoing process. It is not a one-time event. There are situations, we can go to the last slide. I think it is last or second to the last slide. There are situations where we may have to take a break. There are situations where we'll have to postpone. Let us just know that it's not like we must start everything and end everything in one session. In conclusion, empowering dialogues on cancer involves a combination of many things, but we all have to emphasize honesty. We have to emphasize compassion. We have to emphasize tailored communication. We have to emphasize empathy, like I say. And by mastering the art of effective communication, we contribute not only to medical care, but also to the emotional well-being and resilience of our patients. Any other slide after this, I doubt. So I just want to thank you very much once again, Pink Lady. Thank you very much, Pink Africa Foundation, for the opportunity to at least share some of these few thoughts with you. Have a wonderful day as we go along. Thank you very much.
Thank you very much, sir. Before you run away, there's a question for you. I know you're a very busy person, so we are very privileged. You're too busy.
Don't worry. I am
We're really privileged. Thank you for that short and very sweet presentation. Somebody asked in the chat, how do we draw, or where do we draw the line between sympathy and empathy? I think that's a very important question.
Okay. Okay. Thank you very much. Now, it's one thing to discuss with a patient on I understand, you know, it's one thing to make the patient know you understand they could be going through a lot of difficult things. It's one thing to make them realize that, yes, they are not alone on this journey. They are cool. There are so many other people that go through it. There are ways of going through it. There is support on ground and all of that. Now, you are empathic with the patient in letting the patient understand that you also feel as a human being and know that whatsoever they are going through is quite a difficult situation. But sorry, that is sympathy. That is pity. You know, you get the difference. Now, when you are showing sympathy, it is more of sorry, it is well, sorry. The patient is even more likely to feel down himself because he looks at himself. Already the person he's looking up to sees him as an object of pity. I don't know if you get what I'm trying to say. And the patient is still a full human being that has his full personality and his full respect. So you could understand what the patient is going through. You could make the patient get to understand that you know they are going through a difficult situation and there are different routes through this journey and they are not going to be alone. You're going to be there to hold their hands. But you're not just going to be sitting there with a lot of sorry, and nothing else to support them emotionally along the journey. I don't know. I'm just trying to make it as simple as possible.
Yeah. It's very simple. I'm sure it's clear to the person that asked and even to every one of us. It's not easy anyway. I can understand that question. You know, trying to put your emotions. I'm not even an oncologist, but sometimes I'm like, I wish I can just, you know, do this, especially when they are crying. And but sometimes even if you're going to help, you really need to be very objective, you know, and try to. You know, so yeah, was
because if you're not careful, you end up crying along with the patient. It happens. The doctor breaks down in the consulting room, and we are crying. The patient is crying. Everybody is crying. Who is doing the comforting? You know.
Yes. That's very important. Thank you very much. I'm going to let you go. If there are other questions you have for Dr. Otene, you can put them in the chat or send an email to Pink Africa, and then they'll send it to you, and I'm sure he's very busy.
I will try to be online. I will still be online even if I am doing other things so that I could listen and still be part of what is going on. So I'm not going too far away. Thank you very much.
Sir.
Thank you, man. Thank you.
Very
Thank
much,
you.
sir.